At least 1 out of every 4 Americans suffers from allergies. You may be one of them and not even know it. Of course, there are the obvious signs of allergies, but other indicators can be much more subtle. Frequent colds, sinus infections, skin rashes, ear infections, and respiratory problems often suggest an underlying allergy. Allergies are commonly caused by mold, pet dander, dust, cockroaches, and pollen from flowers, weeds, and trees. You can find the cause of your allergy symptoms or frequent infections and start on the path to a happier, healthier life with an easy, pain-free 15-minute allergy test. Before the test, your healthcare provider will get a quick assessment of your respiratory system using a spirometer. You'll take a deep breath and blow out with as much force as possible. The device measures the speed, force, and capacity of the air so your healthcare provider can get a full assessment of your lungs. After you complete this process 3 times and the results are satisfactory, you will move on to the allergy skin test. For this test, your healthcare professional will introduce small samples of particles from the environment to your skin. These particles, called antigens, are most likely causing your symptoms. Usually, antigens cause no reaction in your body because they're normal in the environment. But in people with allergies, the immune system mistakes certain antigens as enemies and begins to mount an attack. Your body expends energy in that attack, and as a result, you can feel lethargic and drained on a regular basis. If you are allergic to some antigens in the droplets, small bumps will soon appear on your skin in the test area, and those spots will feel itchy and irritated. In 15 minutes, the test is complete, and the healthcare professional removes the antigens and reads the test results. With the drops gone, your defense system begins its retreat. The healthcare professional may apply cream or medication to relieve discomfort, if any, and the signs of internal battle will soon fade away. With the test complete, your provider will interpret the results and discuss them with you. You'll finally learn what's causing your allergy symptoms. Then you'll review treatment options together, including some that could give you back control of your life, letting you do what you want when you want. There are 3 options for battling allergies: avoidance, medication, and immunotherapy. Avoidance is not always practical or desirable. With pollen that can travel for over 50 miles, and animal hair that can remain in a home for up to 6 months after a dog or cat is gone, avoidance is a major challenge. In addition, avoidance can significantly impact your quality of life. Medications can give you short-term relief. Unfortunately, they do nothing to alleviate the underlying cause of your symptoms, so the symptoms return regularly. Immunotherapy works by teaching your body's defense system that the particles in our normal environment are not enemy forces. One way to deliver immunotherapy is through injections or allergy shots. This method requires several shots each week for several years. Another way to get the same effect is through sublingual immunotherapy, which means under the tongue. Once a day, you place a few small drops of antigens under your tongue and then go about your day. Highly specialized cells, called dendritic cells, grab the antigens and distribute them throughout your body to desensitize your system, so your body can ignore the antigens that cause virtually all allergies. The treatment starts with tiny doses of antigens in the drops, then increases the amount gradually so your body can adjust without discomfort or symptoms. Soon, you'll start feeling better, and your provider will work with you to phase out your allergy medications. Over time, your immune system recognizes antigens as normal members of your environment and treats them as old friends. Sublingual immunotherapy takes 3 years to fully train your immune system, but you'll begin feeling the benefits within the first 2 months. Ask your healthcare provider if sublingual immunotherapy can help you take control of your life. Your healthcare provider will order your first drops, and they'll arrive in 7 days. One of the major benefits of immunotherapy is that you administer the drops yourself in the comfort of your own home. When training for a marathon, you don't run 26 miles in the first day. You build up. With immunotherapy, you start with bottle number 1. This contains a diluted sample of the antigens. Stand in front of a mirror and hold the bottle straight up and down. Squeeze 2 drops under your tongue, leave them there for 2 minutes, and then swallow. On day 2, take 3 drops. The specific number of drops you take each day is shown on a chart you will receive with the drops. It's important to follow the chart exactly. When you complete bottle number 1, move on to bottle 2. By the time you finish bottle 8 in the first order, your dosage will be at full strength. From this point on, you'll continue with the same dosage for 3 years. When you complete your first order, in 10 to 12 weeks, call your healthcare provider for a quick checkup and order your next set of drops. You will start to feel better within a few months, but it's very important you continue the therapy for the full 3 years to reprogram your immune system. When your treatment is over, you can enjoy life the way it should be.